don't want to look weird. I don't want to look different. I still want to look like myself, just like a better version of myself. The jawline is nicely defined. The neckline is nicely defined. And again, the eyes just look more open and more youthful. Hi, I'm Marcelo Hochman, Dr. Hochman, a facial plastic surgeon here in Charleston, South Carolina. And I wanted to go over some of the things that I look at on initial consultations when people come in complaining about they don't like the way their neck looks, or they don't like the jowls, or that I'm looking tired, that type of thing. And as an illustration, if you look on your screen on the left-hand side, we see what we would all consider a more youthful look than the face on the right. If we look and focus on the middle and the lower third of the face today, I'm going to describe some of those changes. In the middle third, you see how the cheeks on the younger looking face are fuller, they're higher, and then over time, as you go to the right-hand side, you see the development of this groove right here called the tear trough. And as that tear trough gets deeper, this fold gets thicker. And you can see that on me. You can see I have a tear trough here, and this thickness right in here is because this fat, which on the statue is right here, used to be in the position of the tear trough. So you can see that on yourself. And in fact, when you smile, that fat gets pushed up, and that's why smiling increases the volume of the upper mid face. And that is a more youthful look because it mimics where that fat started off. So again, on the aging face photo, the statue here, you see a deep tear trough, you see the high cheekbones, which never change, and you see this crease and this fold becoming thicker with time as things drop towards the center of the face. If you look at the youthful jawline, you see this nice defined jawline. The neck is tighter. On the aging face, you see again the corner of the mouth, the fold. The corner of the mouth is in the same place, but there's a fold that starts dropping down as the tissues fall down. You see the jowling, which is that fat pad which used to be above the jawline. And you can't see it very well on the neck here, but there's excess skin. Usually people complain of laxity, or some people call it their waddle, this loose skin underneath this underneath the chin, which tends to bother people. So again, this is just the transition from a youthful look to a more aged look. Happens to all of us, and is due to gravity, how thick the skin is, color of our skin, those types of things. If you look at that same statue and look at what's happening underneath the skin, like I mentioned, there's that fat pad that's starting to drop down, and the jawline is being obscured by the tissue kind of flopping over the edges. These are the common changes that we see in most every aging face. The other thing is, if you notice around the mouth itself, that skin is still pretty tight, right? So if you draw a circle around the mouth, everything inside that circle, the skin is attached to the muscles, whereas on the outside of that circle, the skin is kind of floating on fat. So as gravity pulls things down, that fat starts dropping down, yet the skin of the mouth, the lips, the chin doesn't really change, except for you start seeing more and more creases. So that's why people complain about fine lines around the mouth, which are caused by the muscle that's attached to the skin, and we'll talk about those at another time. If we look at, again, a patient with some of the typical aging changes, you see the laxity of the lower neck, you see the jowl, the jawline is obscured by this fat, which is flopping over the side. You see this groove, which is called the geniomandibular groove. So genio being chin, mandible being jawline, and that groove here. So there's a lack of volume in that area. And you just see how everything's kind of dropping towards the center. And as I mentioned prior, you see how the skin is still nicely attached to the underlying tissues. Underneath here, you see that thickness, a little bit of fat that's kind of flopping down because the skin and the muscle is getting loose. This is after a facelift. The facelift involves just repositioning some of those tissues. If you look also, there is on the left-hand side, if I draw a vertical line from the lower lip, you see how her chin is a little bit farther back than ideal. And that contributes to the fact that the tissues are falling down. Here you can see how the chin and the lower lip are more closely aligned, and that is due to that we placed a chin implant to add a little bit of volume to help hold things up. Again, this is an improvement from where we started. It's not perfect in the sense that it's not tight, like when she was in her 20s. There's a little bit of fullness here still because of the position of the hyoid bone, which is something I'll show you in another patient in just a minute. But in general, I think that everybody would agree that this is a more youthful look for this particular patient at this particular time than the prior look here. Again, from the frontal view, you see how the jowl, that fat was flopping over the side, that groove was pretty well defined, and now there's just a more continuous line because that implant, not only does it add a little bit of fullness here so that the projection from the side is a little bit better, gives a little bit more support to the tissues underneath the chin, but it also has a little wing that extends this way that helps define the jawline without having to pull things so tight that it makes things look weird. And that's one of the things that patients are always scared about is, I don't want to look like I've been pulled too tight, or I don't want to look not like myself. And that's something that I strive for. Again, the improvement for this particular patient at this particular time, I think is pretty obvious. And again, nobody would, in my opinion, think that she looks anything but just enhanced. Similar situation where, the neck waddle is the big problem for this gentleman. But again, if you draw a vertical line from the lower lip, you can see that the chin is remarkably behind that line, which helps drop down or contribute to that tissue flopping over the edge. If I pulled this chin forward exaggeratedly way beyond Jay Leno size, that tissue would all be really tight because it's being pulled forward. Well, obviously we're not going to do that, but the closer we can get to that line, the more improvement we can get underneath the neckline to help redrape that tissue. This again is the same gentleman. You can see how the neck is much more improved. Again, there's a little bit more projection here, and that wing of the implant helps hold these tissues here. And you can see again the improvement in the neckline. The incisions are all hidden around the ear, behind the ear, and into the hairline. This is a great example of, if you feel on yourself, there's a little bone here. It's a little horizontal bone called the hyoid bone. The higher the hyoid bone, the higher the neckline. The lower the hyoid bone, the more of an angle there's going to be in the profile. His hyoid bone is right here, so there always has to be a little bit of an angle here because that's just anatomy. If his hyoid bone was higher, and I'll show you a patient here in just a second, then that neckline can be much, much higher. But that's something that, again, oftentimes gets overlooked, and the people's expectations are not met because I thought my neckline was going to be higher, but it's just because of the way the position of the hyoid bone is. But if your surgeon doesn't explain that to you, then you could be disappointed, even though things are remarkably better. Why isn't my neckline higher? Well, it's because it's not physically possible. But again, overall, I think this shows a much more youthful look with pretty inconspicuous changes that nobody would look and say, he looks weird or he looks too different. He just looks an enhanced version of himself. Another example, again, of just the neck waddle, so to speak, and just a better, well-defined neckline and neck position. This is a patient that came in complaining of I look tired, I look older, I don't look like myself. I feel much younger than I look. And again, from previous talks, we can identify that her brow is below the level of the orbital rim, crowding her eyelids. You see the fullness here. You see the beginnings of a fold right in there. You see some wrinkling of the neck of the skin. And this is after having placed the brow in a better position. Again, it doesn't take very much to make it look natural, but clear, more youthful look. Nobody knows what happened because those incisions, as I've mentioned before, I make behind the hairline. So I do an endoscopic brow lift. And then the lower face, there's again just more volume, a little bit higher. The jawline is more defined. And this picture kind of shows that, where she overall just looks refreshed, looks more youthful. The jawline is nicely defined. The neckline is nicely defined. And again, the eyes just look more open and more youthful. Patients with darker skin, African American patients, we're all subject to gravity. And again, some of the things that we've talked about before. If I drop a line here from the lower lip, her chin is pretty far back. You see this large amount of skin draping down, the fat overlapping the edge of the jawline, the cheek falling towards the front, and you see those changes here on this oblique view. And then after a facelift with a chin implant, you see her jawline nicely defined. You see a much improved neckline. Again, here's her hyoid bone, which determines where that neckline is going to be. You still see her incisions are a little bit pink, but eventually will fade away. And again, this is just an enhanced version of her from before surgery. And again, I think fits the requirements of, I don't want to look weird. I don't want to look different. I still want to look like myself, just like a better version of myself. And I hope that this was helpful in introducing to you some of the changes that we see. In another session, we'll talk about the specifics of different techniques for facelifting, including the deep plane lift and some of the other things that you hear a lot of things about. Again, thanks for spending time with me, and I'll see you soon.